I'm Dr. Rachel Burnett at Utah Natural Medicine, and I wanted to do a short video to share with our community about the wildly popular drugs like Ozempic, because thanks to celebrities and influencer TikToks, as well as impressive weight loss observed in clinical trials, it seems that everyone is hearing about these medications and a lot of people are using them. And since you can now get these at any corner med spa, it seems, I thought I would offer what I have learned from both the literature and clinically from my patients, and what I think is important for patients using this or considering using this to know. Lastly, I want to share why I might prescribe these medications and how I think of them differently than most providers who are prescribing them. First of all, as we've all seen before, there is no such thing as a miracle drug, and these medications are no exception to this rule. There are benefits that many people will experience with these medications, but there are some downsides beyond their high price tag. And I think that both doctors and their patients need to carefully decide together whether they are truly the right choice for weight management or any other indication they may be used for. So what are these drugs and how do they work? And are there natural alternatives? Semaglutide is branded as Ozempic and Wegovy. Tirzepatide is branded as Mounjaro and Zepbound. There are two hormones or peptides, GLP-1, which is glucagon-like peptide 1, and GIP, which is glucose-dependent insulinotropic polypeptide. Ozempic and Wegovy are only GLP-1s. Mounjaro and Zepbound are both GLP-1 and GIP. It's good to know that these drugs really started as drugs to take care of patients with type 2 diabetes. They mimic a hormone called incretin, which suppresses appetite and delays gastric emptying, but the medications really do so much more. Given the knowledge on how the GLP-1 effect works, researchers have now identified eating behaviors, different foods, as well as exercise that have GLP-1 activity. In fact, there are also supplements. Berberine was dubbed nature's Ozempic, and it was the first to take the stand. Now we have butyric acid, a fatty acid made in your gut from good bacteria, and Akkermansia muciniphila, a probiotic that we know has the GLP-1 effect. What's exciting to me about these is that they highlight the gut-brain connection. So there are alternatives, but I've also found them to be useful when used in conjunction with the medication, allowing patients to be on a lower dose. I've also found them helpful when developing a successful maintenance plan. So now we know what they are. Are the medications safe and are they healthy to use? Well, I've been prescribing them for the last 3 years, and I didn't 10 years ago when this classification of drugs first came out. My patients know that I have safety tattooed along my forehead. 10 years ago, I didn't feel any benefits outweighed the black box warning and the risk of these medications of thyroid cancer. We've now had very large population studies with these medications and safety trials coming out. They keep coming out, such as the Scandinavian cohort, showing that they're very unlikely to cause thyroid cancer. Another safety concern that I see overlooked is knowing the source of your compounded medicine, if this is how you're getting it. Unfortunately, there have been impurities found in compounded versions, and there are counterfeit versions out there too. It has to be done well, and it's not easy to do. This is the reason not all pharmacies do it. There are a ton of regulations surrounding making these drugs. We only use pharmacies I've either personally toured or seen their certificates of analysis for the medication and ask for third-party testing. Lastly, not all weight loss is healthy. The goal is to increase the body's overall proportion of lean mass to improve body composition and not to be skinny fat. And this is happening. It's important to not fat shame. Not all fat is bad. We do come in all shapes and sizes. Genetics determines fat distribution. Some obese patients actually have low visceral fat, even with high subcutaneous fat. So just as you can't judge a book by its cover, you can't judge someone's health by their size. Once FDA approval for these drugs went from diabetes to obesity, studies started using weight as the primary endpoint and not body composition, and I think this is a mistake. One of my concerns is that these medications have been shown to decrease muscle mass, and although losing fat, particularly visceral fat, is associated with lower risk of all-cause mortality, losing lean muscle mass, muscles and bones, is associated with poorer health outcomes and reduced lifespan. Patients are not being informed about this risk, and I see this with all of my patients, not only those with obesity. The drugs are being used for people without obesity and diabetes, and they also need to know about this risk. Because of the possibility of losing muscle mass, measuring body composition is very important. Not all fat is created equally, like I mentioned, so know your visceral fat rather than or in addition to how much you weigh. I would argue that you know your percent lean mass too. We measure this at our clinic with bioimpedance analysis, which is not an absolute value, but it serves as a useful tool for guiding change. There are some risks besides losing muscle mass. In the Step 1 trial, 44% of patients experienced nausea with semaglutide. I tried to titrate the dose very slowly, and this does make it a lot more manageable. In fact, I almost exclusively use tirzepatide because it's tolerated so well. The speed at which you ramp up the drug can dramatically lessen the severity of the side effects as well, and microdosing avoids problems altogether for the most part. So what is microdosing, and why is it being discussed in the longevity medicine space? Not defined exactly, but there are several ways to do this. You start at a low dose, sometimes even half of the on-label dose, and administration doesn't even need to be once weekly. Sometimes we want a particular effect from the medicine without weight loss, so we might dose it differently. And this brings me to the side benefits. It helps the brain and the nervous system through its effect to decrease neuroinflammation. It reduces cholesterol and fatty liver. It's helped a few of my patients with PCOS get pregnant. It decreases overall inflammation. Many patients have told me, I finally feel like myself again. It decreases the risk of stroke and has a positive effect on lowering blood pressure. No wonder it's headline news. Nutrition needs to be emphasized, namely protein. Do you know how much protein you're supposed to have? It's not the same for everyone, and it varies with age. I emphasize exercise, muscle strengthening, and resistance training, how often and how much. And with all of my patients, I underscore the importance of hormones for a foundation to all of this. Beyond insulin, the hormone that regulates blood glucose, testosterone is important too. If your testosterone is low, it will be much more likely for you to lose lean muscle mass. And this goes for men as well as women. Get your testosterone checked. When considering using this medicine, I think it's also important to talk about maintenance, what it might look like. What happens to your body if you stop taking one of these drugs? Studies show you can regain 2/3 of your body weight in 1 year when you go off cold turkey. This is where natural alternatives and microdosing can be helpful. Lastly, cost. Insurance will cover some of these medications for some patients with on-label indications. Make sure your provider is helping you to check because they are expensive. We work to make this as cost-effective as we can and have an efficient, safe program that is driven toward keeping your overall health in mind. I feel that there is a way to use these medications safely. They may not work for everyone. They're truly not indicated for everybody, and they need to be done safely, titrated slowly, and done well. I hope this video was helpful. I'm happy to discuss if this might be a medicine for you. Let me know, call us or send a message in the portal if you have any questions. Last but not least, I want to thank my team. I have an extremely knowledgeable team that helps me. They know who they are.